I felt uncomfortable, I felt ashamed, I felt embarrassed, all around sad.
Breaking from the shackles of society can be tough enough. Then there are hurdles finding the right health care.
And I went and I had the doctor straight up turn me away.
This community has been marginalized within medicine.
Today, we look at the challenges facing those looking to transition.
There's people who turn 60 or 70 and now they're like, okay, I feel comfortable with doing this. Okay, I'm ready now.
I'm almost there. Mentally, I'm there. Physically, the surgery will be the last thing.
This is CBS News Bay Area with Elizabeth Cook.
Thank you so much for joining us today. Well, this Pride Month, we are focusing on issues facing the LGBTQ plus community, specifically trans men and women. They're often denied treatment by healthcare workers who simply aren't equipped to handle their unique medical needs. We look into how they're working past that challenge, and we'll be joined live by the CEO of the San Francisco Community Health Center. We'll have that conversation in just a few minutes, but first, a look at your news headlines. Oakland Mayor Sheng Tao says she is innocent and has no intention of stepping down. Today, she spoke publicly for the first time since the FBI raided her home last week. The mayor said she is not the target of the investigation.
I want to know what probable cause the FBI has. What evidence have they collected that justifies raiding the home of a sitting mayor without notice and without the courtesy of a conversation? I'm not going down like that. We're not going down like that.
Just minutes after the mayor read her statement, a group organizing the recall campaign against her held a rally outside at Francagawa Plaza.
So she'd rather deflect, she'd rather play victim, which we don't need any more of. We don't need any more victims. The real victims in Oakland are the people who are suffering. That's right. She will not survive this recall.
Mayor Tao also questioned the timing of the FBI raid, which came just days after the registrar's office verified enough signatures to move forward on the recall. The FBI still has not released any details about what they were looking for at the mayor's home last Thursday. Agents were seen leaving with several boxes and duffel bags. They also raided a home linked to Andy Dong. He's the member of the family that owns Cal Waste Solutions. We saw FBI and IRS agents taking boxes from Cal Waste Solutions office, and several people confirmed the Vietnamese American Business Association office in that very same building was also raided by federal agents. Breaking news from San Jose, where a VTA train derailed. This is video from our chopper from just in the past hour. The train was headed southbound to Capitol Expressway. We're told 10 people were on board that train. Luckily, no one was injured. And Congresswoman Nancy Pelosi is calling on House Republicans to pass the Right to Contraception Act. She spoke today in San Francisco, marking 2 years since the Supreme Court overturned Roe v. Wade. She was joined by the CEO of Planned Parenthood North America.
This week.
Medical professionals rallied in front of East San Jose's Regional Medical Center today. They say plans to close the trauma center and reduce stroke center services on August 12th will negatively impact emergency care in that area. Regional put out a statement saying it's making changes in line with the evolving needs of the community. And it was a wild scene on the Bay Bridge this weekend. People shooting off fireworks during a sideshow just after 2 a.m. yesterday. You can see cars blocking the eastern span of the bridge while spectators looked on. The CHP says officers broke it up about 20 minutes after the first reports came in. They arrested at least 3 people. All right, on to our first alert weather now. We're actually tracking a chance of showers, even the possibility of lightning. It's a live look at Black Mountain right now. Meteorologist Darren Peck is in our virtual view studios. Darren, are we actually going to get some rain?
We're getting some, Liz, and that camera that you were showing is the best one to look at. Just for perspective, we're looking over the Santa Clara Valley here. This is actually a time lapse. Liz was showing you the live view. I want you to see what this has looked like over the last hour, because now you can see it. See the rain coming down there? We haven't gotten much rain down here that's measurable in the Santa Clara Valley, but you can see some of those drops working their way across that southern and eastern edge of the Santa Clara Valley, kind of heading over towards Milpitas. That's one view, pretty dramatic to be able to see it from the camera that we've got on those mountains on the west side of the Santa Clara Valley. Best thing to do is to take a look at First Alert Doppler. Couple of things about this. There's a lot more activity to this in the Central Valley. What we're experiencing here is just the very far northwestern edge of a complex of thunderstorms, which is overproducing right now. And by that I mean this is more impressive than it looked like this would be when we were looking at the high-resolution forecast models on this yesterday. So a closer look at that shower that's moved across the Santa Cruz Mountains. If you watch this, and we'll slow it down, see that line of rain there, within about the 45 minutes ago, that was able to produce a strike of lightning, which is really what we're going to care most about here. It's not so much that the rain's going to have a big impact. It's that we want to watch for any lightning on the landscape right now. Considering we've already started fire season for the finer fuels, we've seen plenty of that over the last few weeks, whether it's the grasses or the smaller twigs, and not necessarily our forests, which are still doing okay in terms of their moisture availability from the winter. But the finer fuels are quite flammable at this point. So the lightning strikes are the biggest concern. That's where things look at this point with this very isolated cell having just moved over the Santa Cruz Mountains. We don't have any reports from that lightning strike having started anything. But there could be more. So here's the way we'll look at this. We're going to switch from live first alert Doppler as we track that shower over the South Bay. And tomorrow looks like it has perhaps slightly elevated odds to see a little more of this. So we left behind live radar. We're looking at the futurecast now. And we're going to bring this ahead till tomorrow late morning, and you're going to see this little bit of a bloom right there. So the time frame on this is tomorrow morning, and this is where the high resolution forecast models have been on this for at least the last 24 hours ago. We were looking at this as of last night's forecast and putting the focus on the possibility here that once we get into like Tuesday morning through the afternoon, we're going to pull some of this energy right over the bay. And that would be about our 10 to 20% chance to see an isolated shower and occasional strike of lightning. Let's watch how that plays out from the morning into the early afternoon. There we are, like late morning. And then once we get into the early afternoon, most of the action moves off to the east from us. It's a fairly complicated scenario to forecast. This is actually leftovers of what was Tropical Storm Alberto like a week ago. That one made headlines when it came on shore through Mexico and Corpus Christi in Texas. So we're getting the leftover moisture and available energy. You got to have everything come together just right if you're going to get thunderstorms in the bay, and we've got some of those ingredients for about the next 36 hours to watch for. So that's the headline. Let's go ahead and look at the 7-day forecast, and I'll show you that as we look at Tuesday. You can see the cloud on here. You could call this a 10% chance of thunderstorms, but they're going to be really isolated. So it's not, I mean, your part of the bay, likely wherever you are, equally, we all have about a 10% chance of that tomorrow. Then things will calm down by Wednesday, and in other weather news, besides the small chance of thunderstorms, we're going to get a cool down. But later in the week, look at those daytime highs. Those inland valleys will go down into the mid-80s. That's a big improvement from the upper 90s, which is where you were just up until about yesterday. And here are the numbers for the bay. We'll keep an eye on it, Liz. We're going to have much more on this. Paul will be in on the 5 o'clock newscast, and we'll be tracking what little action there could be from those showers. For now, back to you.
As we mark Pride Month, we are celebrating the LGBTQ plus community and also recognizing the unique challenges they face. Among them, healthcare. According to the latest study by the American Cancer Society, they experience discrimination and stress that could lead to serious consequences. The study showed that people in the LGBTQ plus population have a higher prevalence of smoking, obesity, and drinking alcohol, which could also raise the likelihood of cancer. The study concluded that health systems need to systematically increase awareness of the unique needs of this community to help mitigate that risk. But many health institutions are simply not informed or equipped to handle these needs. I spoke with one trans man who knows what it's like to be marginalized by medicine.
And then I just like to add a little razzle dazzle.
Ray Luna speaks to the world through music.
It's like coloring with sound.
Each note, each lyric is carefully curated to send a message about the person he wants the world to see.
I am feminine and masculine and more at the same time at any given time.
Ray started his transition 5 years ago when he was 27 years old. But his journey to this point started much earlier. Even as a young child, he knew typical gender stereotypes just didn't fit.
Felt uncomfortable. I felt ashamed. I felt embarrassed. And just all around sad.
Ray had never heard the term gender dysphoria until a therapist suggested he do a little research, and something clicked.
And I was just like mind blown. So I like literally just cried and like was happy, and then I was like, dang, but this looks like it's gonna be hard.
The first challenge was finding the right medical team. Before then, he only went to the doctor when he was sick. He was in his early 20s when he had his first physical.
But if it wasn't for my transness, I don't think that I would have even started going to the doctor, because it's like I only went to the doctor because I was like, I want to get those hormones that's going to make me happy.
But Ray's transition didn't start and end with hormones. He knew he still had to take care of all areas of his medical care, and that included getting a pap smear.
And I went and I had the doctor straight up turn me away. I kept experiencing stuff like that where people were just looking at me wild. Like, I'm like, yeah, it says F, I'm a female. Yeah, that's what I was assigned at birth. Yep, that's my genitalia, but I'm not presenting as such. And it just felt like a lot of people were uncomfortable with it and having that prejudice.
Dr. Benji Leniakea is the chief of the Stanford LGBTQ+ adult clinical program.
We have to remember that until 2013, having a gender-affirming care was actually pathologized and had the diagnosis code of gender identity disorder. And until the 1970s, even just being gay was identified as like a homosexual, disorder, right? Rather than recognizing these as distinct identities and communities that had distinct healthcare needs.
Dr. Leniakea, who goes by the pronouns they, them, says there are nuances to medical care for LGBTQ patients that often isn't covered in most medical schools.
Our patients might not necessarily have bodies that align with their legal sex or their sex assigned at birth even, right? And so making sure that we are able to do things like cancer screening appropriate for the body parts that are available, right? For instance, transmasculine individuals may have had top surgery, which means male chest reconstruction, to reduce chest tissue and to create a more masculine appearance, removing a lot of tissue that would normally have been screened for breast cancer. Now, not all of this tissue may be removed, right? So the nuance needs to be there in the appropriate screening afterwards. Conversely, our trans feminine patients who develop breast tissue often later in life compared to their cisgender peers will need breast cancer screening, but at an interval that may differ from their cisgender peers who develop breast tissue in puberty.
They make the curriculum for training future doctors like Melanie Ambler, who is in her 3rd year of medical school at Stanford.
This community has been marginalized within medicine, and the fact that I can be someone that can go into a room and attempt to gain back that trust and have the skills to do that is something that's really important for me, so that anyone that walks in the door feels comfortable with the person that they're speaking to, even if they don't share the same identity.
Ray eventually found his medical team that was able to provide the right gender-affirming care, but his transition is still a journey of discovering his true self. That's more than just a pronoun.
When I first found out that I was trans, I was like, I just want to be he, him. And so, but now I feel so much different because I've gotten the opportunity to let go of that and be like, oh, well, I'm actually not just he, him. I have been she. And if it wasn't for she, I wouldn't get to be he, they, them, z's, there. I use all the pronouns now.
A picture of Ray from the 1st grade hangs above his bed. A picture of a little girl who at the time was scared and confused. Who they were on the outside didn't always fit who they were on the inside. A little girl Ray doesn't want to forget.
You could talk to that little girl. What would you say to her?
I would say to her that we're right. That we're right where we need to be, because we're gonna get to be more than we can even dream of. Just never stop being real. You're a real one.
The U.S. Supreme Court just agreed to take up a case involving care for transgender youth. The High Court announced it will review the constitutionality of a Tennessee law banning gender-affirming care for transgender minors, such as puberty blockers and hormone therapy. Still ahead, the CEO of the San Francisco Community Health Center joins me live to talk about the climate surrounding trans rights and the work in the city to help the LGBTQ plus community. Well, the LGBTQ plus community faces some unique challenges when it comes to health care. And today we're focusing on individuals who have or are exploring transitioning gender. Joining me now is Lance Toma, the CEO of the San Francisco Community Health Center. Thank you so much for being here.
Thank you so much, Liz, for having me.
So earlier in that story, we talked a lot about how transgender care, especially when it comes to cancer prevention, there are some nuances with that, but there's also some other nuances when it comes to treating individuals who have transitioned or are in the process of transitioning, right?
Yeah, well, at San Francisco Community Health Center, we actually focus on LGBTQ plus healthcare, but specifically trans and gender affirming care. And it really is from the get-go, from the reception to the nurse, to our social workers, to our providers. Everyone needs to be trans competent and understand the experience of a transgender person. And that really goes such a long way, from pronouns, but to understanding lived experience, sort of the, history of trauma oftentimes that our trans community has gone through, and then just being not being taken care of by our healthcare system. So having folks who really understand that experience is so critical.
Yeah, I can imagine it's as much about mental health as it is about physical health.
Yes, we know that. As you talked about cancer prevention, we know about obesity and HIV and smoking. There's so many factors that are affecting our LGBTQ plus community. Our providers need to understand the totality. We talk about whole person care, and that's what we're about.
So many of the patients that you work with, too, that you've spent your whole career focusing on marginalized communities, not just the LGBTQ community, but so many of your patients are also dealing with homelessness, drug abuse. Tell us a little bit about the work that you do within the community when it comes to these marginalized groups.
Yeah, we are so committed to ensuring that the most marginalized communities in San Francisco are front and center in terms of the care that we provide. And so oftentimes, if you're talking about folks who are homeless, who are struggling with mental illness, and right now the fentanyl and opioid overdose crisis that is afflicting our neighborhoods, it's actually about providing the highest quality care at our center, but then actually going out and taking that care out into the street. So we actually have 2 full-time teams that are going out into the neighborhoods of the Tenderloin and providing medical care, behavioral health care, mental health, substance use care in the streets, in the alleyways, to support folks who just can't make it into a clinic.
Yeah. What do you think would surprise people the most when it comes to what you're dealing with on a daily basis when it comes to this community?
What I will say is that the community is resilient and inspiring. Folks in the Tenderloin care about each other. We learned that in COVID. What we did in COVID is the team that I have at San Francisco Community Health Center, we went out into the street and we actually provided care, education around what it means to shelter in place when you're in a tent or on homeless. And we engage those folks to help their peers and their friends and communities in the street. And we were effective in actually getting the Tenderloin to 90% fully vaccinated. And it's because the community is so remarkable in the Tenderloin. So that's what I always share, is that once you really get to know folks who are really struggling in the Tenderloin, they're remarkable folks.
When you talk about LGBTQ plus care, health care specifically, you think of HIV and AIDS. That's the first thing that comes to mind. Is that still a major issue in this community, given all the preventative measures that are out there and the treatments that are out there?
It is. I think COVID set us back a bit with these past few years, but we remain vigilant. When we did COVID outreach and education with the community, we were having folks make sure hepatitis C was talked about, HIV was the education and outreach efforts, testing that we kept on, making sure that was happening. So we are still on the path to getting to zero in San Francisco, and we're proud of that. But there are communities of color, the Latinx community, that we are seeing increases. So we have to remain vigilant with respect to all of our culturally competent services across the city.
All right, Lance Toma, the CEO of the SF Community Health Center. Thanks so much for being here, and happy Pride.
Thank you. Happy Pride.
We'll be right back. A Bay Area senior is proving you are never too old to strive to be your most authentic self. At the Centers for Elders Independence in San Leandro, Buddy Wolf is now getting gender-affirming support. He says he always knew he was meant to be a man, but growing up in conservative Modesto, he never felt he could be himself. Buddy says before his mother died, he promised her he would get gender reassignment surgery if he ever got the chance. He's now had both breasts removed and has been on hormone therapy. But his planned lower body surgery is on hold because of other health issues. Still, he says,
I'm almost there. Mentally, I'm there. Physically is really, the surgery will be the last thing. And even if my body does things that, I can't get the surgery, then I'm satisfied with what I've got. I finally at least have what I've always longed for, and that was at least to look like who I am.
Buddy's case was the first of its kind at the center, and we'll be right back.
See you next time.
We are just getting word of changes to Mayor Sheng Tao's legal team in the wake of the FBI raid of her home in Oakland. We'll have all the details coming up tonight at 5 o'clock. And thank you so much for joining us for today's 3 o'clock conversation around LGBTQ plus health. The CBS Evening News is next on KPIX. I'll see you at 5.